In February this year, President Uhuru Kenyatta announced the official rollout of the universal health coverage agenda of the Big Four. And with health brings a devolved unit, various counties have embraced public-private partnerships to ensure the success of the UHC.
And with the aim of using technology to ease access to critical services in health, Laura Otieno visited Suba in Homabay County, where collaborations in ICT and medicine have ensured access to quality and affordable healthcare services to residents.
When the COVID-19 pandemic struck, human interaction was disrupted as it morphed into what is now called the new normal, characterized by physical distancing. We're in Suba, Homabay County, to examine the space of technological innovations in the field of medicine to ensure access to healthcare at a time when physical distancing was encouraged. At the Suba Sub-County Hospital, we meet 46-year-old Jared Ogutu. He has brought his daughter for a scheduled appointment with a specialist from Nairobi. For the last 15 years, his second child, Akinyi, has been using herbal remedies to numb the pain in her abdomen.
Yes.
The cost of seeking medical care, he says, was unbearable. He makes an average 200 shillings on a good day to fend for his wife and 8 children.
Najaribu hii na hii dawa ya kienyeji. Bado tunashughulika na hii dawa ya kienyeji juu hii gharama ya hospitali ni juu.
Akinyi is at the Suba Sub-County Hospital in a virtual session with a specialist from Nairobi. Akinyi is one of 32,400 beneficiaries in 4 counties in Kenya using a 200 million shillings telemedicine facility dubbed Daktari Smart. And this is how it works.
They were sent for some tests.
The equipment laid down in this room relays real-time results to the Getro Children's Hospital in Nairobi as the consulting doctor monitors the patient's vitals.
Any oral threat?
Today, Dr. Iman, stationed 400 kilometers away at Getro's Hospital in Nairobi, assesses Akinyi's heart rate.
A stretcher where you can really palpate.
In 2019, the Kenya Medical Practitioners and Dentists Council began issuing provisional approvals to health institutions to offer virtual medical services. By February 2021, 20 facilities had been cleared to use telemedicine, with regulations hinged on the National E-Health Policy of 2016 to 2030. The facilities are to adhere to the principles of privacy and confidentiality associated with the practice of medicine, but also the Data Protection Act of 2019.
I was thinking it might be...
Running on a public-private partnership program, the Daktari Smart platform in this hospital has cut the number of referral costs to patients to 0 as the partners run the 3-year pilot that started in November 2021. And as the government now rolls out the Universal Health Coverage Program, medical experts are urging for increased synergies to ensure the success of the telemedicine program.
You are aware we've had problems with KEMSA, yes? Yes, so we are outsourcing for drugs. At times, they might not get the drugs here. I mean, step up the efforts at KEMSA, let us get the drugs. On family...
The Daktari Smart platform is also aiming to capacity build 1,200 health workers and 1,440 community health volunteers to address the human resource deficit in the country's health sector.
Look at what we are getting. Someone is in some corner in Suba and is getting that high, one of the most highly specialized services. In Muthaiga, to me, that is universal health coverage.
Saa zingine na akiba, lakini hiyo akiba haiwezi tosha. Sasa ina stress mingi sana. Lakini sasa hii ninaweza pata hata tini 2 niweke kwa nyumba. Mimi naweza lisha watoto wangu.
And as the country now rolls out the Universal Health Coverage Program, for Jared, it is innovations such as this that bring the service closer home and guarantee access to healthcare for his children, whom he can afford to raise, and assure them that indeed health is wealth. Laura Otieno, Citizen TV.